Hello, welcome to the lecturer's desk. Get your medical thoughts cleared before you leave. And please don't forget to subscribe to the YouTube channel and turn on the notification bell.
Hello guys, today we are going to talk about ventricular tachycardia. When you talk of ventricular tachycardia, what is it? Tachycardia means a rapid increase in the heartbeat or the contraction of the heart, which is more than 100 beats per minute. That's for tachycardia. So what is ventricular tachycardia? It's an abnormal condition in which the ventricles contract more than 100 beats per minute. And now, what are the causes of this ventricular tachycardia? The ventricular tachycardia, in short, which is what? The VTAC can be caused by various factors, and some of these include abnormality in the electrolyte or electrolyte imbalance. When we have low level of what? Potassium and then low level of magnesium, these are most common electrolytes that can lead to what? VTAC. Now, aside that, patient that is what digoxin, in short, that digoxin what uses, those patients are prone to what? Getting VTAC. And also, it get what? Myocardial infarction and certain what? Heart diseases such as heart failure and then valve disorders. So these factors and many more come together and what cause what? Ventricular what? Tachycardia. So when somebody is having a ventricular tachycardia, as a medical doctor or medical professional, we have to what? Check these what causes or these possible causes that can lead to what? The ventricular tachycardia or VTAC in short. You know what we do on this topic. That is how we can identify this ventricular tachycardia on the EKG graph. But before we get what to the EKG graph, we must get to what certain hints that would give us an idea of what identifying this VTAC on the EKG graph. So stay with me. When talk of what the VTAC, that ventricular tachycardia, the first thing that you must also know is what? For tachycardia, that means the rate of the heart must be what? Rapid. You have what? Rapid heart rate. Do you understand? Rapid heart rate, which is what? More than 100 beats per minute. And then aside that, we have P wave. Absent of P wave, PR interval, absent, ST segment, absent, T wave, absent, and then QRS complex present. So we are going to get only what? QRS complex, and then R interval is going to be what? Regular. Please, this is very, very important because this helps us in what? Differentiating between what? Ventricular tachycardia and then the ventricular fibrillation. We talk about that one in our next video. So this is what basically how it is. The QRS complex is present and wide. So these are the hints that is going to give us an idea of what identifying the ventricular tachycardia on the EKG graph. So when you get the EKG graph, you won't see what P wave, PR interval, ST segment, and then the T wave. Only thing that you will see is the QRS complex, which is very wide, and then it is what? Organized. That means it is what? Regular. It is regular. Now, it's like this. Okay, it's only what? The QRS complex that will be what you will be seeing. Only the QRS complex that you'll be seeing. So on the EKG graph, it is very simple. This is what you are going to see. I have an example of this graph in here. The first graph here is the ventricular tachycardia. Do you understand? Ventricular tachycardia. So you see how it is. You only see the R that the QRS complex. You only see them. There's no P wave, there's no PR interval, there's no ST segment, and there's no T wave. So this gives you an idea of what? Identifying a VTAC. Now, the VTAC can be classified in various forms. Now, let's look at the classification, how we are going to go about. Now, the first classification can be what? Sustained, can be classified as sustained and non-sustained. Sustained and non-sustained. And talk of sustained is where the person or the patient gets the ventricular tachycardia for more than 30 seconds. And then non-sustained is when the ventricular tachycardia happens less than 30 seconds. So we should take note of it. But the most important classification that can what? Help us in what? Identifying the type of ventricular tachycardia over here is what we call what? The monomorphic and then the polymorphic. The polymorphic. You know, in medicine, mono means what? Same. Mono means same. And then poly means different. Now, for the monomorphic, we have what? The same what? QRS complex generating. The same QRS complex generating. And then the polymorphic, we have what? QRS complex what? Differentiating in what? In its structure. Now let's look at something over here. This is what? A monomorphic ventricular tachycardia. Why? Because we have what? The same size of the QRS complex generating. The same size of QRS complex generating. This is what we call what? A monomorphic VTAC. Now, let's go to the what? The polymorphic VTAC. You won't get the same QRS complex generating. And a typical example of it is what we call a torsade the point. It's what we call torsade the point. Torsade the point. For the torsade the point, it's like a cyclic. Let me put it, a cyclic generation of the ventricular what? Tachycardia. A cyclic generation. So that one, how does it happen? The torsade the point is happening like this. So this is how the torsade the point happens. So you get what? A cyclic. It starts as low amplitude. It starts with low amplitude of what? QRS complex. And the amplitude would what? Will be increasing. Or will be what? Increasing. And then some parts it will be what? Decreasing. And it will be increasing again, and it will be what? Decreasing. This is what we call what? The torsade the point. So an example of a torsade the point is this graph. This graph. You see the ventricular what? Contraction was what? Very high at this point. And here it was low. Here it was high, and here it was low. Here it was high. So this is like what? A cyclic. It goes high and it comes down. It goes again and it comes down and it goes. It's a cyclic. It's what? It starts small, it increases, and it comes back again, it increases. This is what we call what? Torsade the point. It's a typical example of what? Polymorphic ventricular what? Tachycardia. So we should take note of it. And this is one common ventricular tachycardia that can lead to what? Ventricular fibrillation. So we should take a very good note of what? The torsade the point, and how we can what? Identify it and go about. So this is basically what we can what? Use to identify what? Ventricular tachycardia, whether monomorphic or polymorphic. And when it's polymorphic, we can know when it is what? Torsade the point or not. Now, let's look at how we can treat this. The treatment can be on what? On drugs, and it can be what? Other factors. So the treatment on drugs, you can also use what? The antiarrhythmic what? Drugs. Some example of what is your amiodarone. You can use this drug in the treatment of what? Of it. But the treatment also depends on what? On the stature or the condition of the patient. The patient which is what? Is stable or what? Unstable. So it depends on what? On the doctor or the medical practitioner how to go or look at what? The condition of the patient and use what? In the treatment. And also we can also use ICD, which is the implanted cardioverter defibrillation. That is implanted cardioverter defibrillation and others. So this is basically what we talk when we talk of ventricular tachycardia. What is it? Let's do a very quick recap. Ventricular tachycardia is what? Abnormal generation of what? Electrical impulse in the ventriculus. Do you understand? In the ventricles. And then this gives rise to what? An increase in what? The heartbeat, which is more than 100 beats per second. And it can be what? Classified as monomorphic or what? Polymorphic, or can be classified as sustained and non-sustained. The sustained is more than 30 seconds and the non-sustained is less than 30 seconds. And the monomorphic, of which what? The structure of the QRS complex are the same. And then the structure and the polymorphic, the structure of QRS complex are different. And the typical example of it is what? The torsade, the point. So this brings us to the end of today's lesson. Please, if you find the class very interesting and you are interested to wait for more videos, please click on the like button and then subscribe to the channel so that anything that you put again on the channel, you'll be the first person to see and also enjoy our lectures. See you in our next video.